So, hi everyone. This is Himaja and Anil from Chennai, launched and coached by Murthy and Alikya, mentors are Daya and Ratna. So, I'm senior functional nutritionist from Wilson's Health Community, and husband, he is a branch head and manager in one of the private sector banks. And first of all, hearty congratulations to each and every one of you who have selected this platform to be a part of our vision and mission of Wilson's Health Community and to better off many lives. And yes, you are at the right place, guys. And really, we appreciate all your efforts. So you have reached till this chapter in the journey of your level 1 training. So all the best to complete your course and certification in flying colors, guys. Okay. So let's not wait more and let's dive into our today's topic. Yeah, so hope my screen is visible and I am audible, guys. So today we are going to see about diabetes and why I am sharing this topic. Yeah, so this is my own type 2 diabetes reversal transformation from Wilson's Health Community under the guidance of my coaches Murthy and Alikya. Okay, so how my transformation has started. So in COVID, I was affected by diabetes and I have been under medication for 2 months, but the medicine didn't work for me. And as per doctor's advice at that time, I have used medicine for 2 months and I have stopped. But after 8 months, again, all the complications have started to come up. And that's where I thought to check once with my diabetic levels. So, and my HbA1c was 8.7. And I was looking out for alternatives where I can completely transform my life. I wanted to have a 360 degrees transformation because I have already seen my father suffering with type 2 diabetes, where his entire body got collapsed and almost he was away from the work. I didn't want to get to that stage in very early age. And when I was looking out for alternative, I have come to know about the diet from Wilson's Health Community through the post by one of my friends in Facebook. And I have approached my coaches. And that's where I can say that this beautiful transformation has happened. So after 120 days of diet, I have successfully reduced 20 kgs of my overweight. And in 90 days, I have reversed my type 2 diabetes. So my HbA1c levels have come down from 8.7 to 5.3. And not only type 2 diabetes, as you can see, so a lot of inch loss, weight loss, and even I have reversed my PCOS issues. I had stage 4 osteoarthritis and I had disc bulge issues, back pain, neck pain, and so many things, guys. Okay. So even gut health, high cholesterol levels, and fatty liver. Okay, so everything I have reversed, and it was a beautiful transformation. And my transformation has inspired me to learn about this art of nutrition so that I can help my kids and even all my parents, in-law, sisters, and brothers from both sides of the families were suffering with so many health issues like overweight, infertility issues, PCOD issues, and even pre-diabetes and diabetic conditions. So that I wanted to learn and to help my family. So that's where I have started with my transformation. I also was an ex-banker. And inspired with my transformation, earlier I was doing as a nutritionist in part-time, and it's been now 2 years. Now I am a full-time nutritionist serving all the clients to reverse all their health issues. Okay, so this is all about me. And now, what is diabetes actually? Okay, so diabetes is a chronic progressive lifestyle disorder that promises a life of slow, painful decline and early death. Yes, right. Nowadays, we are seeing so many people. So once if diabetes starts, so till their last breath, they have to suffer with it. Okay, so the meaning of chronic is for the lifetime, we have to suffer with it. And yes, definitely the quality of our lifestyle is also coming down, and people are going into lot many issues, as we can see. And even the lifespan of a person also will come down. And lifelong, we have to depend on the medication. And sometimes even the help of medical devices is also required. And sometimes even surgery is also required. Okay. So when all this will happen, if there is no proper and better emphasis on the nutrition part, and so many medications will be prescribed, and sometimes even people how to take insulin injections also. Okay, and what is the side effect of taking all these medications and insulin injections? It will result in weight gain for the patients. So whatever these techniques that are being offered nowadays, okay, they are really very much expensive and they can only manage the diabetes. That means, for example, now my HbA1c was 8.7. So whenever we follow all the techniques that are available right now in the market, my HbA1c level will be maintained at 8.7. But it is not going to reverse the diabetic condition. And in fact, they are very expensive as well, guys. Okay. And 80% of the world's adult diabetics, people suffering with diabetics, are living in developing nations like India. And rates of diabetes are also rising at the fastest rate in lower income class and middle income class people. Okay. And International Diabetes Federation estimates that worldwide rate of diabetes will reach 1 in every 10 people by the year 2040. So what is the main cause for diabetes? So hope each and every one of you have gone and understood about the concept of insulin resistance in the weight loss chapter. Okay. So now diabetes is caused by our bodies because of the insulin resistance. Okay. And because of insulin response to chronic overconsumption of carbohydrates. Body, when it cannot handle so much of glucose, then what happens? It will lead to obesity condition, diabetes, and a host of other chronic lifestyle disorders as well. Because all this glucose, again, as you have listened in weight loss session, it will get stored in the form of fat at different parts in our body, which is leading to all the health issues. And yes, what is the fact one? Type 2 diabetes is fully reversible and is also preventable. Okay, why? Because type 2 diabetes, it is not a disease, it is just a dietary disorder. So whatever the dietary disorders are there, definitely medication is not going to help to reverse. Only dietary changes and lifestyle changes and fulfilling the nutritional gaps can help to reverse the diabetes. And weight loss is the most important determinant in reversing diabetes and maintaining the ideal weight. It is the first step towards preventing the occurrence of type 2 diabetes. And fact 2. Diabetes is caused by too much of sugar. So when a person is taking too much of sugar, what happens? Overflow of glucose will happen in all the cells in our entire body. Okay, and too much of insulin is produced when the glucose is more. Okay, and then it is forced to push more glucose into the body cells, which our body cells will not be able to accept. And this is where it is getting converted into fat and it is getting stored at different parts in our body. Lower insulin levels by reducing dietary intake of sugar and refined carbohydrates. Okay, when we reduce the dietary intake of sugar and as well as refined carbohydrates, we will be able to lower our insulin secretion levels in our body. And insulin injections and metformin. So what is the function of those? What they are going to do? They will take out the glucose out of our blood and it will deposit back into the body. And then this glucose will get shipped to other organs like kidneys, nerves, eyes, or heart, which eventually leads to other health issues in our body. Because so many people will think like whenever they are taking insulin injections or medications, the HbA1c levels are under control. Okay. But what's actually happening from blood? We are, of course, going to take blood test only, right? Okay. So those levels are going to reduce from our blood. And what is happening instead? That glucose is getting converted into fat and it is not going out anywhere. It is still staying in our body, which is getting deposited in different organs and hence leading to health issues in different organs in our body. Okay, so what is the classification of diabetes mellitus? There are different types of diabetes. So type 1 diabetes, type 2 diabetes, gestational diabetes. Okay, so what is type 1 diabetes? It is an autoimmunity condition where the pancreatic cells will not be able to produce insulin. Hence, they have to be under insulin injections for the lifetime. And what is type 2 diabetes? So we are going to learn about it today. And gestational diabetes. Okay, so we will see what it is. And because of genetic defects also, a person may go into diabetic stage. And pancreatic disease. Of course, yes, insulin is being secreted by beta cells in pancreas. Okay, and hence having any pancreatic related disease also will lead a person to go into type 2 diabetes. And it can be as a side effect of any drug or chemical that we have taken. Because of some kinds of infections also, a person may become a diabetic. Okay. And because of endocrinopathies also, a person can go into diabetes. And so, as I said, type 1 diabetes we have already discussed. And when coming to type 2 diabetes, so insufficient insulin secretion will happen in a person's body. Okay, so this is the reason for a person to go into type 2 diabetic stage. And what is gestational diabetes? So, when a woman is pregnant, body will not be able to produce insulin for regulating the glucose levels in that pregnancy. And whenever a person is having gestational diabetes, there are many chances that in future they will get affected with type 2 diabetes. And what are the symptoms of diabetes? Always feeling hungry, unexpected weight loss, numbness or tingling in hands and feet, frequent urination, sexual disorders, and always feeling extreme fatigue and tiredness, and always feeling thirsty. And what are the complications? Yes, there are many complications, which even we will see in the later part. Okay, and wounds will heal very much slowly. Okay, and neuro-related disorders, cardiovascular disorders, nephropathy, okay, heart diseases and eye damage. So all these are the complications of diabetes. Okay, and additional symptoms what a person can have: inflamed or red gums in the teeth, okay, in the jaws, and urinating excessively, and always feeling hungry, always feeling irritability and anxiety issues, burning or tingling in the hands and feet, okay, and also having a dry mouth, always feeling dehydrated, and always having some confused thinking. All these are some of the symptoms of diabetes. And how can we diagnose diabetes? There are so many tests available in the market, okay, which can tell us that a person is diabetic. But the most common test that everyone suggests is HbA1c. Okay, so what is HbA1c here? So Hb means hemoglobin. Okay, so what is hemoglobin? It is a protein found inside red blood cells in our body. So what is the function of hemoglobin? It will carry oxygen to entire body. Then what is HbA1c? It is the amount of glucose that is attached to hemoglobin in the body. So it is the average of our blood glucose levels in the last 3 months. So for example, when A1C percentage is tested, so if it is less than 5.7, okay, that means a person is normal and is not diabetic. If the HbA1c ranges from 5.7 to 6.4, it means that the person is in pre-diabetic condition. And if HbA1c is greater than 6.4, it means diabetic. A person is diabetic. And as the HbA1c level goes on increasing, the risk of complications also goes on increasing. And my HbA1c was almost 8.7, right? So somewhere it comes around here. Okay. But now, thank God, now always whenever I check, my HbA1c ranges from in between 5 to 5.3, and never it has crossed 5.3. Okay. And diabetes can also lead to complications in many parts in our body, and it can increase the risk of dying prematurely. Okay, as we can see, it can affect our legs, kidney failure, heart attacks, and even eye vision and stroke in brain. Okay, so many complications we will learn one by one. So when glucose levels pile up in our body over from 10 to 20 years, so every cell in the body will start to rot. Okay, so eyes may become blind, and kidneys may go to the stage of dialysis, and heart attacks and heart failure, and brain may get affected with Alzheimer's disease. Okay, and a person may get started with non-alcoholic fatty liver disease or cirrhosis, Okay, and diabetic foot ulcers in the legs, diabetic neuropathy for the nerves. Okay, still much many more tiredness. Okay, all these complications. Okay, so these complications are divided into three categories: microvascular, macrovascular, and other complications. Okay, so all these are categories like retinopathy, nephropathy, neuropathy, heart disease, stroke, brain stroke, atherosclerosis, peripheral vascular disease, Alzheimer's, cancer, fatty liver disease, infections, skin and nail conditions, erectile dysfunction, and polycystic ovarian syndrome. Okay, so all these effects of diabetes are categorized into micro, macro, and other complications. Okay, now we will see about each of these. Okay, so what is retinopathy? First of all, what is retina? Okay, so retina is light sensitive nerve layer which is present in the back of our eye. So what is its function? It sends picture to our brain. So how diabetes is going to affect it? Diabetes will weaken the small retinal blood vessels, which will cause blood and other fluids to leak out. Okay, and whatever the newly formed blood vessels are there, they also will start to become weak and fragile, and hence they will be easily broken. So when they break, what happens? It results in more bleeding and formation of scar tissues. So now what these scar tissues will do? It will lift the retina from the eye and it will pull away from its normal position. So then what happens? If retina is not in its position, the person will become blind. And of course, laser treatment, it is going to seal and it is going to destroy the leaky nature of the new blood vessels. But this is not a permanent solution. Okay. So for persons who are into type 1 condition, in about 20 years, they may get affected by this retinopathy. And for type 2 diabetic patients, even before the diabetes is diagnosed, okay, most of the times, up to 7 years before the diabetes occurrence, they may get affected by this retinopathy. And what is nephropathy? So it is nothing but the failure of kidneys. Okay. So what happens if the kidney failure happens? All the toxins will pile up in the kidneys. And because of that, what happens? Loss of appetite. A person will not have hunger. So they won't eat anything and it results in weight loss. And they may have nausea and vomiting also. Then what needs to be done? Person has to take dialysis. So what this dialysis will do, it will artificially remove all the accumulated toxins in the blood. Okay, and what is the frequency? 4 hours, 3 times in a week. Okay, each sitting, they have to do 4 hours and it has to be repeated 3 times in a week. And it doesn't happen all of a sudden. It takes nearly 15 to 25 years to develop nephropathy in a person's body. And 2% of the diabetic people are developing this kidney disease every year. Okay. So 10 years after diagnosis and 25% will have evidence of kidney disease. Okay. And what is neuropathy? So 60 to 70% of diabetic patients are affected with this neuropathy. It will affect peripheral nerves first in the feet of the patient and then in hands and arms also. What are the symptoms of neuropathy? Tingling, numbness, burning, pain, decreased sensation of touch, vibration, and temperature, and loss of reflexes in the affected parts of the body. And a person will have more such symptoms in the night time. And even when they start taking painkillers at that time also, it is not going to help in any way. And sometimes even it may result in complete numbness also. And a person may also get Charcot foot, which means complete destruction of the joints. And because of that, the person will not be able to walk, and even the condition of amputation also may come. So what is amputation? So it is like that particular portion of the infected leg, maybe up to the knee. Okay, it has to be removed. That is what we call as amputation. So we can say so many diabetic people getting amputated, right? Okay, and next is amyotrophy. So what happens in this? It is characterized by severe pain and muscle weakness in the thighs of a person. and it will be like a repetitive thing. Okay. And damage to autonomic nervous system, that means the main central nervous system in our body. It may result in nausea, vomiting, constipation, diarrhea, bladder dysfunction, erectile dysfunction, and orthostatic hypotension. That's why even we can see diabetic people always being so dull, right? Okay. They may be having any one or many of these symptoms. Damage to the nerves in the heart, it will increase the risk of silent heart attack and even death of a person. So the next is atherosclerosis. So here we can see the difference between a normal artery and an artery that is suffering with atherosclerosis. So the plaque will get deposited, and because of this, what happens? Okay, so it will be keeping on progressing, and the growth and rupture will happen, and ultimately it can lead to blood clots also. Okay, we will see in detail about it. So what are plaques? Plaques of fatty material are deposited within the inner walls of the blood vessel. So because of this, it will lead to narrowing and hardening of the blood vessel, and it leads to heart attack and strokes in the brain and peripheral vascular disease. Okay, all these are collectively known as cardiovascular diseases, and it results mainly from injury in the arteries of a person. So in this case, what happens when injury happens in the arteries? The muscle that will support the tissue of the blood vessels, okay, it will proliferate. And there is also a structural protein found in our body, which we call it as collagen. So this collagen also will accumulate in response to this injury, and it will result in narrowing of our blood vessels. And breach of artery walls initiates inflammatory cascade. That means whenever this injury happens to arteries, so inflammation of the arteries also will happen. And what are the contributing factors for this atherosclerosis? Age, genetics, smoking, okay, of course, diabetes and stress levels, high BP, and lack of physical activity as well. And it will also lead to atheroma. That means it is a pocket of cholesterol and smooth muscle cells, inflammatory cells, which will limit the flow of blood to the affected organs. When the blood is not getting flow to the affected organs, what happens? It has to get amputated over a period of time. So rupture of atheroma leads to blood clots. Okay, sudden blockage of artery by the clot prevents normal blood circulation. So whenever blockage is there, proper blood circulation will not happen in the body, and it will starve the cells of oxygen. That means lack of supply of oxygen happens to the body cells in the affected area, and it will lead to cell death and finally to cardiovascular disease. And so the next thing is heart diseases. So how it's happening? So heart disease is the most well recognized and feared complication of diabetes nowadays, and it is caused by atherosclerosis. So what happens in this case? Actually, sudden blockage of arteries will happen. It will starve the heart of oxygen. That means proper oxygen supply to the heart will not happen, which will result in death of a person. Okay, how the person is expired? So once the death of a part of the heart muscle happens. Okay. And if it is at the extreme stage, the person also will expire. So 68% of the diabetic people whose age is 65 plus, they are dying of heart disease. And 16% of expiries in case of diabetic people is because of stroke to the brain. And now what is this stroke? It is also caused by atherosclerosis of the large blood vessels supplying the brain. So what happens in this case? There will be sudden disruption of the normal blood flow, and the supply of oxygen to the brain or a particular portion of a brain will come down, which may lead a person to death. And symptoms will differ basis which part of the brain is getting affected. And diabetes will increase the risk of this stroke by 150 to 400%. 1/4 of all the new stroke cases that we are seeing nowadays, okay, is for the people suffering with diabetes. And every year, the stroke risk of diabetic patients is also increasing by 3%. And peripheral vascular disease. So this is also caused by atherosclerosis of large blood vessels supplying to our legs. So sudden disruption of the normal blood flow will happen, and even the legs will get deprived of the oxygen carrying hemoglobin. What will be the common symptom? It will be pain or cramping that will appear with walking, and it will get relieved when a person is taking rest. So when blood vessels narrow and circulation becomes worsen, pain may also appear when the person is resting, especially in the night time. So peripheral vascular disease, it will reduce mobility of a person, and even it can lead to long-term disability. And skin with poor blood supply, it takes a lot of time to heal. Minor cuts and as well as injuries that will happen to the foot of the diabetic people, it will take longer time for healing, and sometimes even they won't heal also. Okay, so if these minor cuts and injuries are not going to heal, it will turn to diabetic foot ulcer, and even in some cases it can still worsen and it will even turn to gangrene. Okay, so if a person is suffering with gangrene, what happens? The underlying tissue of the foot also will appear to our naked eye. Okay, so in case of gangrene, what happens? Blood supply will reduce greatly, or the blood supply is completely lost. Even we can see there are some instruments and devices which will help us to detect and understand whether blood supply is happening into the foot in case if a person is affected by gangrene. So basis whether that circulation is there or not, they will decide whether this person can be with the leg or whether it has to be amputated. Okay, so the tissues also will die and it will result in amputation of the affected limb. And 4% of the diabetic patients will need an amputation, and it will result in cycle of disability, which will lead to less physical activity in them, and which in turn will lead to weakening of the body muscles. And what are other complications of diabetes? So Alzheimer's disease. So it is a chronic progressive neurodegenerative disease that causes memory loss, personality changes, and even cognitive problems. And diabetes also may lead to cancer, various types of cancer like breast cancer, stomach cancer, colorectal cancer, kidney cancer, and endometrial cancer in women. And it may also result in non-alcoholic fatty liver disease. That means storage and accumulation of excess fat. Okay, and how this excess fat is stored in the form of triglycerides, and almost fatty liver will contribute to 5% of the total weight of the liver. And diabetes also may lead to several infections in people like bacterial or fungal infection like thrush, vaginal yeast infections and infection in the nails, or it may lead to athlete's foot, and more dangerous being infection to the limbs, having 15% increased risk for lower limb amputation. And it can lead to various skin and nail conditions also. So we call it as acanthosis nigricans. That means we can observe some dark pigmentation around the neck of the people suffering with insulin resistance or diabetes. And it can lead to diabetic dermopathy. Okay, and we can find some skin tags on the eyelids or on the neck or near armpits or sometimes even on the stomach. Okay, and even yellowy brown thickened nails also can be seen, but they will be separated from the base of the nail. And it can lead to erectile dysfunction in some men, okay, which will lead to poor blood circulation is the reason for it. Okay, and the risk increases with the age and the level of insulin resistance in that person. And in women, it may lead to PCOS issues, polycystic ovarian syndrome. So it can be like irregular periods or heavy bleeding and having a various number of cysts in the ovaries. Okay, and so many other PCOS issues. And the best part is our diet, Wilson's diet can help to reverse PCOS issues in the women. So we need to treat the cause, but not the symptoms. So always taking medication like metformin and insulin, it will be like we are working on the symptom. So when we work on the symptom, the underlying cause of insulin resistance is still going to be there in the body. Okay, so here our diabetes reversal diet program will help us to treat the cause. Okay, we will directly work on reversing insulin resistance in the body. And because of this, whatever the health complications we have seen right now, a person can be away from all these complications and it will improve his longevity as well. Okay, so definitely I feel very much blessed to be a part of this wealth and health community, transforming my own health. And it's like a completely 360 degrees transformation. And always I am so much of thankful and showing lot of gratitude to my coaches as well, because they have given me a new life. And in fact, they have saved life of all our family members by not going into all these severe complications of diabetes. Okay, and as all of you know, we do recommend some of the supplementation as well. And today now we will understand how these supplements are going to help clients when they are into diabetes reversal diet program. Okay, so the first is plant protein. So how does plant protein help? So it helps us to improve the insulin sensitivity in the body. Okay, it will be lower in GI and hence it will reduce the insulin spikes as well. And it will also reduce inflammation. Okay, and it helps in weight management, better heart health, and even gut health, because plant proteins will contain good fiber in it, and it is also easily digestible. It is having PDCOS value 1, and hence it is easily digestible also. And it has sustained energy levels also will be provided. It contains all the 9 essential amino acids, which helps for building good muscle mass. Okay, and it is also nutrient dense because it is, of course, coming from plants, right? And it is also having less amounts, or in fact zero fats or only good fats. It depends on what are the ingredients present in plant protein, because various varieties of plant protein are also available. But the one that we are going to recommend, okay, definitely it is going to give the best results because it is having all these qualities. Okay, and how multivitamin is going to help diabetic patients, because we can see so many doctors recommending multivitamin tablets. Okay, but here always the supplementation. Okay, it is a natural one and it is having more benefits and it will work on the root cause. So it is going to address all the nutritional deficiencies. It will support insulin sensitivity. Okay, so already you have understood about the concept of insulin resistance, right? So insulin sensitivity is exactly opposite to insulin resistance, and it will reduce inflammation in the body. It will support good metabolism and energy levels, and it will protect a person against the diabetic complications. It helps to have a healthy weight, and it will support good cardiovascular health, and it improves overall well-being of a person. And because of high energy levels, even the body metabolism also is going to be proper. And how omega-3 fish oil capsules are going to help. It will improve insulin sensitivity. And of course, it will reduce inflammation. Okay, so how it is going to reduce inflammation? It will produce nitric oxide in the body. And because of that, whatever parts in the arteries are affected, okay, there it is going to release this nitric oxide, and hence it will heal that artery also. And hence inflammation reduction is possible. It will support for good heart health. It will improve the blood sugar levels in the body, and it will reduce the risk of diabetic complications, which is the most important thing, and helps in good weight management. It supports overall metabolic health. It will also reduce oxidative stress in the body, and it will improve our mood, brain functioning, and it will also reduce our depression, and it also helps for good nervous functioning in the body. And how calcium is going to help? It helps in blood sugar regulation. It supports bone health, because people affected with diabetes, okay, so the bone health also will be in deteriorating state. So it is going to support for their bone health, and it will reduce the potential risk of diabetic nephropathy, like kidney damages also. It will help to reduce, and it will support healthy blood pressure, and it will regulate the hormones which are involved in blood sugar control. It will reduce the risk of diabetic complications, okay? And it will work on insulin sensitivity in combination when it is used with remaining all other supplements. It helps even in weight management. Okay, it helps us to have good bone mass density also. Okay, and it will enhance overall health and well-being. How garlic supplement is going to help? It will improve the blood sugar control levels. It will enhance insulin sensitivity. And even it helps in reduction of blood lipid levels. That means bad cholesterol, bad triglyceride levels. So it will help in reducing all this. And it has anti-inflammatory properties also. Okay, because of this, it will help to reduce inflammation in our body, because diabetes is mostly associated with inflammatory conditions in the body. Okay, because of the anti-inflammatory effects and properties, garlic will help the diabetic person at the best. And it gives us the antioxidant protection and potential weight management benefits, and it will regulate blood pressure, and it will help in improved circulation in the body, and it has potential liver health benefits as well, and it will also support for a person's gut health. Okay, and focusing on the gut health also plays a major role in reversing diabetes for a person. Okay, and how CQ10 supplement is going to help? It will support for blood sugar control. It will help in improving the insulin sensitivity, and it also acts as an antioxidant. It will support for heart health. It will reduce inflammation, and it will help to reduce or prevent diabetic neuropathy. And it will give improved energy levels, and it will reduce our fatigue. And it will help in liver health, and it improves blood pressure regulation also in our body. So this is all about our today's session on diabetes reversal. So hope I have added some value, guys. Okay. So now, since we have understood what happens to a person if he is affected by diabetes, we may be having many people around us who are suffering with diabetes condition, from our mobile contacts, from our school friends, college friends, or their parents, or our colleagues or ex-colleagues. Okay, our near and dear ones around us. So let us now make a list of such people who are suffering with the diabetic complications around us. Okay, and let's do one diabetes reversal awareness session with the help of our coach, and invite all of them to that session. Let us create an awareness about all these. Okay, and let's help them to reverse their type 2 diabetes and live a happy life with much of longevity and abundance as well, guys. Okay, so stay fit and stay healthy and keep learning, and all the best to complete the course in flying colors. So next chapter will be taken by next speaker. Bye bye.